A parishioner at the city hospital has been requesting that a minister of care bring Eucharist to him for a few days now. Typical, right? Do you get those calls at the rectory, or Kelly gets those? Yes? When you reach his room, he is at the lab for tests. That's also typical, right? Right. Since he has been asking for 3 days now without having received Eucharist, you decide to wrap the host in a tissue and leave it on the side table with a little post-it note that you are sorry that you missed him, but he could find Jesus in the tissue and self-communicate. That's pretty good, isn't it? All right. What's wrong with this picture? Yeah, you don't leave the host in the room, something like that, all right? Because who knows what would happen to that tissue? A cleaning person comes, or, it's just bad kind of thing. And what kind of pastoral care is that, to read it on a post-it note? Would the person feel happy that you were there, or sad that he missed you, or what would it be?
I think they'd be confused. What do I do? Because we're not supposed to give ourselves
all kinds of things like that. But sometimes this is the mentality of overzealous, poorly trained Eucharistic ministers, that I'm going to put Jesus all over the hospital kind of stuff, okay? And then for people that are not Catholics, they kind of wonder what we're doing, okay? So you have to have your sensibilities. Is this a Catholic environment? Do they know what we do? Do we operate, with the good graces of the institution and things like that? All right? Any more on that? Do you carry tissues and post-it notes with you? When I was training at Mercy Hospital, there was an old Mercy sister, and she worked the 3rd shift. But she made her initial visits like at 2 or 3 in the morning. And she always wrote a little note, "Dear, I was here to see you, but you were sleeping." Well, thank God. So, anyway. Number 3, you are in a big rush and really tired, but you have made a commitment to be a minister of care. So after morning mass, you take the Eucharist from the church in a pyx. That's all right, isn't it? And stop by the local nursing home. The staff has some 20 residents in the day room for the prayer service. You don't have time to check who is Catholic or not. All right? You skip the normal reading of sacred scripture and the communion prayers, and just ask everyone to pray the Lord's Prayer with you. You then offer Holy Communion to everyone in the day room and leave. Got that done. All right? Now I can go grocery shopping, kind of stuff. Any corrections there?
One of the priests that was a pastor of the parish, one of the parishes that I was working with, said, would make a comic reply to that, and he would say, "We have a lot more new Catholics here." New Catholics.
Yeah, new Catholics, or First Communion. Yeah.
You know.
As representatives of the parish and of the Catholic Church, we should really try to figure out who is Catholic and who isn't. And I don't know how some places do that. They put them in one section, or they give them a little badge or something. Or if you're there for an extended period of time, you kind of know who is a Catholic and not. You want to be ecumenical in your prayer and in welcoming people, because it is the nursing home, it's the common day room, and everybody has a right to be there, but not everyone has a right to receive the Blessed Sacrament. Because the very fact that communion implies a special union and solidarity with the beliefs of the church, okay? So basically that's the teaching on reception of communion in nursing homes and hospitals and things like that. Sometimes people, seminarians will come and say, well, it couldn't hurt, kind of stuff. No, it's not a matter of couldn't hurt kind of stuff. It's really, what do we believe and what have people defended and died for, for centuries kind of stuff. And it's not an exclusivity kind of thing. It's just a sensibility for the sacrament. Are you with me on that?
Yeah.
Okay. If you're really rushed, could you have done this on another day, or do you have a backup if you can't take the nursing home? Would it have been better to ask somebody else to do it?
Could
Or
I just
no?
ask for the Catholics to come up and receive communion?
Of course, you could do that. But then sometimes, you know, if they're wheelchair bound or whatever, or if they're not lucid, then you have this kind of shuffling. And sometimes people can be upset that they didn't get what everybody else was getting. You know, I've had situations like that. Yes?
Perhaps you have a couple more people. I mean, you make a plan beforehand,
Right.
but you're not the only one doing
Yeah. That's good. Any other strategies, best practices?
But you can't, the minister can't take that as a blame for his being inefficient in distributing communion because somebody was not Catholic that.
Right,
took it.
right.
I mean, you
Yeah.
do what you can, the best
Right.
you can.
Yeah. But it's not like you know something and you do it anyway.
No, right.
Okay. Yeah. Good point. All right? Yes.
We don't ask them, like, when was the last time I went to confession?
Yeah.
You know, or stuff like that. It's
Exactly.
just the fact that, what if somebody has to pray with you or to pray with them, that's one thing. But, you know, I don't go into reading, especially when I visit people who are homebound who are dying, literally, you
Yeah.
know, bro, you know what I mean? It's just like, that's not.
Yeah, that's what we call the pastoral judgment. We know the rules and regulations and the sensibilities of who we are, but we also call that in canon law ecclesia suppla, that the Spirit provides and the goodwill of the person, okay? Because really, and we say that prayer before we receive communion ourselves, I'm not worthy, okay? But when we start to make all kinds of conditions, you know, especially people that are dying or sick or whatever, this is a moment of grace, okay? Good point, Ed. Can we go on to 4?
Yeah.
Okay. You are making your communion rounds on the skilled care floor of the Catholic hospital. Both patients in room 321 are Catholics and have requested Eucharist. When you enter the room and identify yourself, you notice that the woman in bed B is crying and upset. Her roommate informs you that this woman has received some bad news from her doctors and is doubting God's love and care for her. You ask the woman in bed B if this is true. She sobs a tearful yes. You then lead both women in prayer and give communion to the patient in bed A, but tell the patient in bed B that she cannot receive Jesus today since she is in such a state. You tell them, have a nice day, and leave. Have a nice day. All right? Any suggestions on that?
It's about the worst thing you can do. She's the person that needs Jesus the most.
Yeah. She should have had a little more TLC and attention, and then bring them both around to God is present in good times and in bad, you know, that kind of stuff. But that minister of care made the judgment that, you know, you're upset now, so you don't get Jesus, kind of stuff, which we can kind of chuckle to ourselves, but sometimes it's like, oh, you're doubting God, then, you know, you're not worthy, kind of stuff, which is a little hard. Right? Anyone else? Yes.
Would that be one where you would do individual with each one of them?
Yeah, sometimes if, and again, you have to kind of know the territory or the protocol. You pull the curtain and then give individual attention to this patient, and then you move to the next one. Because otherwise it's like, is she on a different health insurance that she gets communion and I don't? You know, those kind of things, yes.
Yeah, or even ask the woman who's upset, you know, she would like you to come back, you know,
Yeah.
later on.
Exactly. Those kind of things, all right? You're pretty smart. This is a good group. And 5, you and your neighbor are both ministers of care, but every winter both of you drop out from this ministry from November until May, since you are both afraid of catching a cold or the flu. And there are so many different people coming into the neighborhood nowadays, spreading all kinds of germs. One just can't be too careful around sick or dirty people. You do enjoy, however, the annual spring luncheon that the parish provides for the ministers of care. This is Kelly's nightmare.
Dropping out is a good idea permanently.
Yeah.
Wrong ministry.
Yes.
Sometimes we forget this is not volunteer, but it's really ministry.
Yeah.
And people are counting on you. So if you're busy Thursday afternoon, you really made a commitment. Okay, this is ministry. This is something that we should really take very serious.
Right.
That the coordinator maybe could be informed that they get coverage. There's another opportunity of that. But there's it's very different from, you know, going down at a food pantry and passing out cans of corn.
Right,
Okay?
right.
This is something that we should take very seriously, and we're very privileged to be in this position, to be able to serve the Lord.
Right. It is a commitment and it is a ministry. But sometimes people do have legitimate, you know, you can't get around on the ice or this, that, or the other thing, or you go to Florida, whatever it is. But you don't just show up for the spring luncheon, right? Kind of thing.
You certainly don't feel good. I mean, out of guilt or whatever. I mean, it's very serious when I say
Yes.
if you don't feel good, and you think you're guilty of not going, you don't feel good. I mean, I'm not saying you go out, you know, and go do something else for you feel it. But if you don't feel good, you don't go, because you can make somebody else sick.
Right. In Catholic high schools, we used to give the award for perfect attendance.
Yeah.
You know how horrible that was? They would come, you know, spewing their germs and everything, and it was horrible. So, a little common sense in this day and age, right? Okay? Once again, I thank you. This is marvelous, and it lifts me up to see that there's so many well-trained and dedicated and prayerful ministers of care that are in our archdiocese. So God bless you, and keep up your good work. Okay?